we person for do. Let we come to the test of himself. The first step. When not the first step, we person can we one the request form.
Well, we can prick in finger and a blood sample we need from in finger, not all like we did draw from in hand or just a little prick. Then we put inside a rapid test kit. Then we can wait for the results like just 1-2 minutes.
We come out.
Yeah.
Right. So in the first place, we person can come, then it tests positive of that particular sick deal. What can be the reaction that moment? Say?
Well, some people like in shock, then someone can panic, some people then get different ideology of the sick, someone can even view and way worse than HIV. So you can see the panic but then the surprise, the confusion. So you just get for be calm and try for talk to the educate them first but the sick, then we'll not look way forward for you and the person now how you will get a treatment or maybe you don't even need treatment.
So let's look at the gender balance between man and woman. Who that can come mostly for the test?
The man then can come mostly for the test and man then can more be positive.
So after we post it on test positive, waiting like some of the word them wanna can get to them for courage them.
First of all, we dey tell them how we dey transfer because some man can get the mere thinking say even sweat, you dey get her. Some man feel say even if you touch the next person, you go dey get her.
How true about that?
No, it's not true.
So how will it transfer?
Well, can get them from back, then this blood transfusion within the do and using of this needles like for tattoo. Even we the woman themselves we can go to a salon, then needle stuff there and sexual intercourse.
So for salon, na hepatitis B na in the most renowned way people know. Also na the bad one. Pardon.
Bad one are from B stats. Then you go to C and D.
So the one that we can basically na waiting na B mostly on a C.
Yeah, because the A not all there and the A can wear off. So from the B now, you know they get a cure for B unless you're vaccinated against it.
All right. That's now we reporter Usman Kamara. We been go work na the City Globe Pharmacy. Outside people they do test for the hepatitis B and they been talk to the Pharmatech when Asia Tuba will be taken through the process of how then they do the testing for the hepatitis B.
The program Good Morning Salon they continue and from that waka day where Usman Kamara go do na Globe Pharmacy, outside people on the go for do test for know them status on the hepatitis sick. Today we tell una say na World Hepatitis Day and because of that we get na the studio with we the coordinator from the government task force when na Dr. Suleiman Lako. They are this morning for cancel we waiting government on the do for fet hepatitis na salon. Well, hepatitis sick na inflammatory condition where the liver can get most times from viral infection where na can cause them. And inside 2015, WHO been pull statistics where they show say globally, but 328 million people get this hepatitis B and C. Where inside that number there, but 1.5 people don't already die from the sick. And as salon different people don't do study them, where don't show say, but 8.7 health worker them get hepatitis B and 11.3% pregnant woman them. That's woman them we get belly don't test positive of hepatitis B. When implanting at the country. Well, for we can know more about this sick, how person they get them and how it on the transmit when they can call it chain of transmission, how it is like na salon. Make one small one for welcome Dr. Suleiman Lako, when a coordinator for the National Hepatitis Task Force, na the Ministry of Health and Sanitation. Good morning again and welcome to the program.
Thank you very much, Mabel. Good morning, listeners, once again.
Doctor, I begin for talk. I give people a brief background about hepatitis, but it gets some medical term them where like some people where they listen not go understand the medical term then they. So begin for tell listeners them what's in a hepatitis.
Yeah, Fambulem, now good morning once again. For start for say today, now World Hepatitis Day. And globally, around the world, all man excited for see how best and they celebrate this day. Well, it's more like a commemoration for make sure say people are aware about this sick we then call hepatitis. And this now because this sick now a serious problem to the whole world and to we na Salonaya. So as a result of that, the whole world ready today for make people aware as we be done they do throughout the year. But more importantly, for make this day let people and get as much knowledge as possible. And this time make we happy way Radio Democracy give the opportunity for can talk to people. And I believe the other media houses they do the same thing today for talk to people. Now when they say hepatitis, now sick way they affect the liver. You know, in Latin we say hepat, now liver. And in medicine, when the liver get issues, somebody go say itis. Then just they add word them for make sure say we get terms. But we get one structure inside our belly, we then call liver, we now affected by this particular sick, we then call hepatitis. Now I make them call that name day. So if you not even sabi that name day, you know able call and just say that's liver sick. That will make somebody understand because that's the most common sick of the liver. We then they progress to other things. The liver now a very important structure inside our body. Now in one, not to like other structures there, like the lungs when are twin, or the kidney when are twin. The liver now in one, and they play vital function. In fact, sometimes they can even look at from the context of say, now a manufacturer, the liver na factory of the body. They produce certain agents that we need for function as a body. The liver, they serve as storage. So in one grain, they serve as store as well for make sure say it keeps some things the way the body need and release them where the body actually require them. So they make sure say provide that opportunity. The liver also, they serve as a security sector. They make sure say it protect the body from various insults. So if somebody happen to forget things like tumbu where they carry inside the liver, they help for contain that, they for help other structures for make sure say with defense system they function well. So the liver now a very vital function. Now one we get problem, then it means say replacement no day, other structure no day for support that day. So this make this day a very vital because anything where they affect the liver, for take and say this a condition we very vital. Now, but not just this day, hepatitis as a whole for be vital, and we all for take them as a serious entity.
So now, what thing they go wrong with the liver where they make person get this sick?
So, as I say, there are various things that way they affect the liver. Various things then. Well, like if you go applying people and they take contimedicine, and even inside freedom, contimedicine get tendency for damage the liver. So that's one thing that they where they affect the liver. People that way they take alcohol in excess also get tendency for affect the liver because alcohol during the process for where the liver they try for handle the alcohol, it can generate some chemical where they affect the liver if it is in excess.
Dr. Lako, when you look at statistics about the hepatitis all over the world, it will show you say about 240 million people all over the world, they live with chronic hepatitis. And some of them people they also they live in a low and middle income country them. As today na the day and they look at the whole situation of the sick, let's try from narrow and down to the Sierra Leonean context. How we go able to describe the chain of transmission of the hepatitis na Salonia?
Okay, so fine. As we talk in terms of the causes, the most common for we na hepatitis virus infection, where the virus then they affect the liver. And the virus there, I guess some that we actually specific, where then go inside the body, now the liver specifically then they go affect. And the one there now the most common one there where they cause this liver problem. And the one there now they will call viral hepatitis. The one there, they don't name the A, B, C, D, depending on whose stem we actually then discover them. But among them, hepatitis B and hepatitis C, now they get tendency for live longer inside the system. And therefore, now then they cause 90% of all cases of viral hepatitis infection. So this, now make we focus on the one there. Because 90% of all cases of viral infection are hepatitis B and C. And if you see that statistics we give 250 million people as a result of hepatitis B alone, at the end of the day, the whole world, they live with hepatitis B. And about 73 to 77 million people, they live with hepatitis C. So if you look at them, that in fact is almost more than the population of West Africa. Now we begin count from here to go Nigeria, look at the population, and so many other people. But when it comes to Salone, we're not able to get data who go say, oh, this is generalized to the whole population. But we get information from them small study that people don't do. Some people that don't look at people that we then say high-risk people for hepatitis, like we the healthcare workers, we they at high risk because the procedure they do we can get tendency for precursor. And during the process, we might acquire hepatitis. So among the healthcare worker population, the prevalence now 8.7. Now what does this mean? Nearly 1 in every 10 healthcare worker likely for be hepatitis positive. This now imply.
Doctor, not to all man the pseudonym and say let go do random test for knowing status of any kind sick. And today we look at this particular sick. But waiting at the signs and symptoms them, wait for make somebody trigger and say, la go check so until I don't catch this sick.
All right, okay. So fine. The signs and symptoms, I go on can they maybe. Let's just type for see how we give people statistics and tell them about how this sick they spread. So I say we healthcare workers we are at risk, but beyond that, other people we are blood donors. People they go donate blood, so then they go give, and then they most of the time, not general population. Then just they go in a hospital. They don't do studies. Some study they then find out say they want then they prevalence. It go to 15.2%. That if you take 100 people where they go donate blood, up to 15 of them get hepatitis. Then if Motama will say Motama and a half, so nearly 1.5 person out of every 10 people who they go donate blood get hepatitis.
Why they be so?
Now because they sick they people then get the sick. And as that lady been they talk, man them get this sick more than woman there. And most of the blood donors are men. And therefore, they get the tendency to get hepatitis, probably from activities that they do, as we can talk about the transmission, how this sick they spread. But beyond that, we also get other group of people, like belly woman. Then they go hospital, where then they go, then test them. Doing that process, we then call antenatal care. That one, then the prevalence, now 11.7. So over 1 in every 10 belly woman from that study, they get this particular tumbu, we then call hepatitis B inside them blood. Now, if you can also, so even them picking them, they also get significant prevalence of hepatitis, but it don't reduce with vaccination. And now it don't come to 1.3 to 1.6, picking the day below the age of 10 years, because then they give them accolades. And that's something that they will go talk. But people will get HIV. We do small study, and we realize that they will get HIV now 21.7%. So 21.7% of the people where they live with HIV actually get hepatitis. Now, how people then they acquire this hepatitis? This largely depends on the type of hepatitis. But the focus this morning, now the one where they say hepatitis B and hepatitis C, because they get similar means by which then they spread from one person to another.
So they talk about the hepatitis B and the C, doc. You can just take me through the transmission pattern, how somebody they able to transmit this particular sick to another.
Yes, so hepatitis B and C, then they transmit one through sharing of sharps. If me go shave, then the other person use the same blade, whether in a machine or razor blade. The tendency, if me get hepatitis, for make that hepatitis, they go to the other person.
That's if cuts happen.
If cuts happen, and at times, they know say cuts happen. Not to all time blood they come out. You then call micro trauma. So small bleed cuts they happen. You never even know. And then they get tendency for serve as root for spread this sick from one person to another. But beyond that, this sick they also transmitted by sexual intercourse. Hepatitis B in particular, because if person get through that secretion where they come on either from the woman or the man, the virus stay inside it. So they get tendency for exchange the virus during that process. So sexual intercourse, just like HIV, hepatitis B, they transmitted in that route.
How long this tumbu they live inside somebody before say you don't get infected by the hepatitis B or C?
It actually variable. To be frank, some people they get the tumbu, then they remain so they know. So until later in life now, they get liver cancer. Some man go there up to 20 years, some man 30 years.
So you're not getting no half sign that we're going to show from the beginning?
It will get some man, they show nothing. Then get just the inside system, especially in children. We begin then get hepatitis, they don't show nothing. Then can they so maybe take we then go down past 30 years. So until then some problems begin come in. So for hepatitis B and C, usually then the day inside person body, they don't know, nobody know. The person not know, or that person not they see ampanam. Now I make a fine for make all man go to hospital and go doing tests. Know your status, when you know status, we go find solution.
How often you go advise the general public for letting they go to hospital and check their hepatitis B or C status?
The first thing is hepatitis B and C. Hepatitis B get maclate. If you go, you take the maclate. And if the maclate effective, it don't provide you protection for at least 15 to 20 years. First now, if you get major wound, now you go take what they call a booster vaccine. Another vaccine where they come or where they use now for boost the security system we don't create inside body against hepatitis. So meaning, if you don't do that, don't become protected for hepatitis B. And hepatitis C, if you not get it, take precautions. These are things that they provide to people. They always say negative messages. For let you end up for continue for stay negative. As long as you remain negative.
So
but of course, on annual basis, if fine for let you do then check then if at all able to stay negative, or even if you stay negative for let you know yourself, that's go fine for hepatitis C. Hepatitis B, take maclate and be safe.
Quickly, doc, if you get underlying illness, then you can get infected by hepatitis B or C. How dangerous this situation can be?
Now, frankly, it depends on the type of sick. Some them can go exist. They can get blood pressure, get hepatitis B, or get hepatitis C. All man, they take your own part. The blood pressure, they take your own part on the way they affect the body, provided they not take medicine. The same thing with hepatitis B or C, inside they take your own part. Although at times, when you look at the end term, some hepatitis B get tendency for affect the liver, the kidney, sorry. The hepatitis C also get tendency for affect the kidney. Now, the blood pressure also get tendency for affect the kidney. At times, then they happen. Hepatitis B and C, then they affect what we call the glomerulus of the kidney. So that interaction might be there. But there are sick them we they refer to as toxic synergy. Relationship we no good. We na hepatitis B or hepatitis C and HIV.
We can't talk about this relationship, Doc.
Yeah.
We can't talk about this relationship. But quickly, the time from studio clock now 8 o'clock. Let me take this short commercial break.
Salon Commercial Bank don't come with new banking products them for make life easy. With Million Online Bank and Million Mobile app, you can able for use Salon Link money transfer for send money to anybody elect you not get bank account. Transfer or receive money na the same bank or any other bank. Transfer money to person or office elect you not get the account number. Buy Ed-Salite, pay other bill them, and now get advanced salary. You don't need for worry again, but almost money then you earn. Because you can able for pay for things the way you buy in a supermarket and other shop them with the quick response code payment. Yagbadon done for we boss man them. With Beyond Online Direct, you can upload salary, pay all you supplier them, sell forex to Salon Commercial Bank, and watch your account anytime. If you need the app, download them from Google Play Store or any Apple Store, or go to Salon Commercial Bank website www.slcb.com. Sierra Leone Commercial Bank, delivering value.
Commercial Bank.
I swear for help people the way they do small thing for survive, and then one the way they run place like cinema all for manage their life during COVID-19.
The Anti-Corruption Commission get what say people they go around a Kambulto area now Watalo they take money na people in hand, especially women them for register they forget about 1.5 to 2 million loans.
The Anti-Corruption Commission will make all man know say the money where World Bank and government of Salon they give for help people and then tell me now 1,309,000 loans.
If anybody asks ask you for money for register you, or if you been don give money to anybody back, call ACC na 515 or report na the police station wey dey near you.
Make sure say you no give penny to anybody for register you for get money wey World Bank and Government of Salone give for help people dem during this COVID-19 sick. This message comot from the Anti-Corruption Commission with support from World Bank.
The program Good Morning Salon they continue 2 minutes after 8 at the time from the studio clock, and we dey look at other issue now. Also, the person wey President Bio pick this BNTM for be Chief Electoral Commissioner. Now the National Electoral Commission, Mohamed Kenewi Kone say if member of parliament them agree for make it be the new neck boss, it go conduct free, fair and credible election them. It talk this na Parliament Committee Room 1, where member them na the appointment committee be the interview in and other people them for no waiting them people here where President Biobi don't pick this BNTM for work na different office them plan for do. Before Parliament go get for a look inside the appointment. Well, Princess Spears and with parliamentary reporter. He gets more on this and go now report.
Mohamed Kone, na the proposed chairman for the National Electoral Commission (NEC), don go answer to plenty question them from member of parliament then at the appointment committee na parliament. Then question na some of the concern them from the different political party them. Outside people be alleged say the proposed NEC boss no register for the last election and no resign before he get an appointment. Now for sake of this, make the leader of government business na parliament, Honorable Matthew Sanyuma, been put this first question to the proposed NEC boss.
Are you a registered voter?
Yes, I am a registered voter.
You have the document in front of you?
The registration?
You have a registration card, photocopy in front of you?
It's not here with me.
Did you supply the voter ID card? You have it with you?
It's in my bag. It's not here with me now. You have a photocopy of it?
Okay.
I have a photocopy.
We would like to see the original.
I will submit that afterward.
Apart from all the thing them, where person go get and qualify for be the NEC boss, the main point na if e no go attach to any political party, where this na be other question where the leader of government business, Honorable Matthew Sanyuma, been put.
Mr. Chairman, the Electoral Commission core principles or guiding principles include accountability, integrity, independence, credibility, professionalism, and transparency. That has been my guiding principle throughout my professional career. I served in Sierra Leone in the Anti-Corruption Commission just from the university. I read accounting, but I prefer working for good governance institution. And therefore, if I'm given the opportunity, if the House of Parliament approve my nomination, I will ensure that those guiding principles will be the hallmark of my administration, where I have to incorporate everybody. I will operate open door policy, where everybody will have the space to talk, to bring out issues where we can collaborate and where we can work together to maintain peace and order in Sierra Leone, and also conduct an election that will be accepted by the Sierra Leoneans and the international community at large.
As the interview question and answering session, they continue to Mohamed Kone for be the next NEC boss. But the concern are that the term where Mohamed Kone get the appointment and the term where he left as director of the Financial Intelligence Unit. Now this question, the Member of Parliament for Constituency 050 Natonkolili District, Honorable Hassan Sise, been put to Mohamed Kone.
From what we have here, you took up the job in 2019, January. That's correct?
I was approved in 2019 January, but I took up the job in March.
In March
2019.
Okay. And the resignation here is telling us July 2020.
Yes.
Just last week or something like that.
Yes, please.
But are you conversant with aspects of our constitution, talking about public officers taking positions like this? Are you conversant with that aspect of the constitution?
That has been the public discussion, and it's in the constitutions as well, under the qualification to become a member of parliament under 75 and 76.
Okay. Are you conversant with 2.4 of the constitution?
I'm not a lawyer, but I have fair knowledge about it.
But you have not resigned for 1 year before taking this, coming from the interview.
Apart from qualification, One other thing wey don be concern at the election dem na the country na that how the system go dey make sure say people wey no dey na the country get access for vote. Honourable Kane Koleyum Kela, na the leader for the National Grand Coalition Party na Parliament, bin ask how Mohammed Kone go solve this issue if he be the new NEC boss.
If the system is corrupt, the leader can't do much. The Electoral Act already allows diasporans to vote in their countries of residence. What has been missing over time is the process for them to vote. Guineans vote in Sierra Leone, they vote outside, Senegalese can vote anywhere. What would you do to ensure that in 2023, diasporans can register and vote in their countries of residence as others have been able to do other African countries?
If I go to NEC, I'm going to review what has been said about NEC, what has been said about elections, and what we have in terms of human resources, in terms of the financial resources. With regard to the voting, what are we not saying? How are we going to do that? But it's something that needs to be considered.
As different question dem be dey comot from the member of parliament dem na the committee, but how the proposed NEC boss go able handle dem kind officer, and if e go able do the work wey e no go take order from anybody. The chief whip for the Sierra Leone People's Party, Honourable Dixon Rogers, been quick for caution the member of parliament dem because to wetin im know, Mohammed Kone get this kind record wey Salone Election Commission dey look for.
If there is anybody in this world that I can live my life for integrity, work under pressure, that's one man I can do that for at any time. When we talk about tribes in this country, he's one man, he doesn't know tribe. Most of his friends he has come across with are from the north, western area, and so forth. It's my interest, this panel, to know that he married a very beautiful Creole wife. To tell honorable members that that man has gone beyond tribe, and I'm sure when he's approved, not if, they will work in the interest of this nation. Honorable members, if you ask me to live my life for him at any time, I will do.
After this interview, the next step for the proposed NEC boss na for go na the well of parliament for approval. For Radio Democracy, Princess Pierce the report.
We continue with the program. Good morning, Salone, where they come to you from the Society for Radio Democracy, 98.1 FM. We still get Dr. Suleiman Lako in the studio, where the coordinator for the National Hepatitis Task Force from the Ministry of Health and Sanitation. As today, Tuesday, July 28th, country them all over the world, they come together under one theme for raise awareness about hepatitis B. And the theme for this year, now find the missing million. We still get Dr. Lako where they tell everybody sick and how people they get from one person to another. Doctor, we look at the way how the sick they spread and some of the statistics the way you just give it for Salonia. Somebody go and say it's scary, although treatment they for them. Waiting at the present situation now from an interview where we reporter do with the City Globe Pharmacy when I want place society people can go for do test and know their status and self get treatment. Then self say na man the more they test positive. What in this mean?
Well, the whole thing means we got to do something as a country. We as a ministry we don't begin do things that way they make sure say we reduce the burden of this hepatitis from the people. We, as a ministry, don't take some steps together with partners them for make sure say, indeed, hepatitis, we're able to reduce and may not be a challenge to we, as people in this country, by the year 2030.
What's that step then?
We, the Sustainable Development Goals, United Nations say, that for be benchmark, London can see a public health problem to that end. In the first place, we set up this task force, the National Hepatitis Task Force. We get a lot of experts from different fields, from clinicians, we get people from public health, we get people from laboratory, we get people from the civil society. So all around there come together. They say no eating. Now they advise government on stringent actions we government they take for able to make sure say we control this particular sickness we call hepatitis. And now one, this for reduce the burden on the total population. And the other one, now that the Ministry of Health work with them partners. Say, love yourself in a small way, begin understand what they go on with this hepatitis. And 2019 and 2020, with partners in health Nakono, will be able to vaccinate, screen, and treat 200 medical students from the College of Medicine and Allied Health Sciences. So provide that comprehensive package because they want their for be doctors. So when somebody become doctor, they are at risk. So if you don't vaccinate her, you don't prevent the sick. But not just that, inside Kono, over 600 healthcare workers there also benefit from similar package of care. We include for screen them, that's for test them for know if they get hepatitis. If they not get, then give them vaccine. The one they will get, then put them on treatment. Now this we do with partners in health.
The vaccine we talk about, Doc, una already don't get a set of people and the way you say una vaccinate, so we get for do with the medicine school. But for ordinary people where they listen you, how they go access this vaccine? Because if una want for tap the spread of the sick and una no one for let people get them, then go for no waiting for do. How they go get the vaccine? I think where somebody just to go by NSI.
No. So the aspect of the vaccination, the other aspect is the fact that, when it takes something from the roots, when are them picking them, that's when they don't prevent a large population where they grow, not go get hepatitis. And what the government do inside 2007, he introduced what they then call hepatitis vaccine as part of the routine immunization. So the routine immunization for give them picking them athlete. And then they don't gain momentum in the sense the coverage is over 90%. So all man they say, no, la go give me picking athlete, we reach 6 weeks. La go give me picking athlete, we reach 10 weeks. La go give me picking athlete, we reach 14 weeks. And then 3 dates there, they help we for make we reduce the prevalence. And if you look one study we then do, inside 1998, they find out say the prevalence be high, but then picking there, it's over 15%. But we then look at now, this BNTM, one study we partner for do with the United States Center for Disease Control, then they don't reduce from 15%, over 15%, to somewhere now around 1.3% and 1.6% to them picking their way below the age of 10 years. That strategy they work. But not just stop there, we say, well, let's introduce another component of vaccination. So then picking them. One would be given and called back dose. So then born picking within 24 hours, then give a maclet. We do that, the effort reduce the prevalence more. Now, when you don't handle something from the roots, you don't effort reduce the burden on the next coming generation. But government not get a strategy for vaccinate the total population, the general population at this moment.
Right.
Why? Because the costs we involved with that is so huge.
So some people can willing for pay for do test and for get vaccinated. I make a ask.
Yes, so people in the way they get vaccines somewhere else, different facilities, and even if you go in a government hospital or something, they provide vaccine for you and refer you. But that you have to do with cost. You have to do with cost.
Not
just something government do free.
The time from studio clock now, 15 minutes past the hour, 8 o'clock. We take another commercial break now the program.
Better don't come. A Union Trust Bank again. Union Salon Banco. Union Trust Bank get plenty products and service there for you. You must get what you want to go better. Like we savings account, ide. Current account, ide. Fixed deposit account, ide. Credit facility, ide. All for you. Me and you. Union Trust Bank, that's a loan for me and you. Kids future savings account, ide. School fee savings account, ide. Pay advance salary scheme, ide. We branch and they all up but not alone. Boko no kenema, we de. Kabalama bogo kakambia, we de. Galafri Town, Lone and my lengthy one. Me and you, Union Trust Bank. Me and you, Union Trust Bank. Union Trust Bank, na Salona for me. Union Salona Banco. Union Trust Banco.
Union Trust Bank, empowering Sierra Leonean businesses.
Rokel Commercial Bank, don't make her the waka with me bank na me phone. Rokel Commercial Bank, go make you the waka with you bank na you phone. Them you come with SIM Corpo, and now they don't increase the facility. For sure say na them na the Alagba for banking business na now they don't come with SIM Corpo Plus. They don't come with SIM Corpo Plus. This service go allow you for send money to person where they salon anytime you want. It no matter the mobile coming where you there. As you send me go get some quick one. What's nice inside salon you there? You money go reach you. It no matter if you there na the east, west, north, south. So secure then you go na Google Play Store and search for the app SIM Corpo Plus. I say download them. Follow the instructions and register your device. The process no long no even reach 2 minutes. When you done the bank go send message na your phone. For confirm say na your phone number bang. Enjoy e-Corpo and more facilities. SIM Corpo Plus e come for we all. You dey na city or village just na salon you dey. You e-Corpo go reach you dey. Enter top up self now they under the facility. With e-Corpo, you can cash out your money from any local commercial bank agent or branch all around the country.
We continue with the program. Good morning, Salon, where they come to you from the Society for Radio Democracy, 98.1 FM. We where they bring the program come to you this Tuesday morning. My name is Khadija Bangora.
And Mabel Kaba.
We look at more issues them inside the program, and now they take one per way other headline story. Outside the public relation officer for the Bombali district, member of parliament them. We same way so na the deputy chief whip for the All People's Congress APC party na parliament. Honorable Catherine Zainab Tarawali don ask government for investigate the Makeni riot quick one for make them know wetin been kill them people them na this riot. Honorable Catherine Zainab Tarawali talk this after Wawaka, where one team wey President Bio set up been send na Makeni for go do one peace talk with the stakeholder and community people them inside Makeni, where the MP themselves have been part of this meeting. Musa Kamara gets more and he go now report.
This BNTM could cast Bimbina Makeni for sake one standby generator, who say some people been lost in life. Now for sake this make President Bio been sent special team way inside there. Now the Minister of Political Affairs, special advisor to President, deputy chair for the APC party in Parliament and other one them. But first you go ask now, what in have been the role? Ambassador Fode Yumkela have been the leader for the delegation.
The message was quite clear. One, as father of the nation, he realized something like that happened any part of the country, will even result in the loss of lives. You understand? Immediately he sends he is deeply saddened and that he regrets and disappointed as to the outcome of what happened in Makeni. Number two, that they put together a team and a body where they go look into every aspect and every facet of what happened will lead to this and the circumstances and the way they handle it. Number three, since there was loss of life, it is sent in we for go sort of expressing condolences to the bereaved families. So those are the three issues.
The All Political Parties Association Northern Region, now the body where the different political parties them gets na the north, but why then concern. Capri Toronka, now the Northern Region chairman for APA.
You know, say all political parties they concerned about the issue we take with Makeni, and most of the one that we get affected, they are all members from different various parties. Don't set up one plan so that we go for talk to the youths and also talk to the parents that will get affected. Yesterday, if I can tell in the evening, we don't visit homes of people that were then lost, then picking them during the riot. We will continue today by 4 o'clock also for visit other homes.
As the team been the present waiting them fair out to President Biona State House, MP them from Bombali been they move one motion na Parliament who said them call on government for get independent committee we go look inside the issue them we happen na Makeni for sake the standby generator. Honorable Dr. Mahmoud Kaloko of Constituency 32 now the person we move the motion on behalf of MP them from Bombali.
We the members of Parliament representing the people of Bambali District hereby requests this Honorable House to institute investigation on the violent siege on Makeni City and the alleged use of excessive and disproportionate lethal force by security personnel against unarmed and defenseless protesters that resulted in the loss of lives, several bullet injuries, and arrest of innocent citizens.
But wetin make the MPR move this motion after this meeting where dem be don get with state hosts. Honorable Zainab Catherine Tarwali, na the public relations officer for Bombali MP dem.
Government send delegation, yes, we no go deny. And the position of the Bombali MPs, they're very clear. Now, three things to the central government. One, from the Saturday, when they take brothers them, go now Freetown to the pathologist for men and go do a post-mortem to allow get the results of 14 kill with brothers them. Up to this moment where they talk to me people them na Sierra Leone, we not get a result. We want a result of the death of our brothers, that is one. And make the result they follow a befitting burial. We tell them for say, initially they arrest 51 of our brothers them and sisters them. Police check them go na Freetown. And as I talk to you, up to this moment, we don't know the position of our brothers them. May they investigate to brothers them. Anyone pan they will find guilty, fine. May they send on a court, the court of law day. We self go send representatives them for representing at the court of law. But you know, go keep somebody after all one I don't shed blood. You go keep somebody unwantedly.
Honorable Catherine Tarawali say, even though they get peace na the tongue, but say they still worry because of rumor where they meet them say some pan the people them where they all they die in a custody.
Makeni is peaceful. The only thing we dey cry for we brothers them. And the only thing we can add to the cry now on Saturday, where we get the news of the death of our brother Alusain Sisi. Alusain, now an SSC student where they attend at the Benevolent Islamic Secondary School, na Makeni. Now class he come out because they take class for prepare them for the WASC exams. Come fire am na in neck and in soldier, fire am na the 8. Alusain, we dey cry for you till we meet you. Alusain, we, the daughters and sons of Bombali districts, they cry for you, and we go ever remain for member you and the other 5 others.
Forgive civic bearing to the one that we lost in life. Free the one them we not concerned pan the riots, we didn't know on CID. Now some pan the recommendation them from the community people and Makeni to government. We make a turn to Ambassador Fudeyum Kela again. For no how far government don't go with their recommendation since we then present the report to President.
His Excellency is very, very top of this situation. That body has already been set up. A week or so, or 10 days. They should have come up with something. Well, because the other one was the question of the funeral, the civic funeral. Well, that day we make it quite clear that was beyond me for make we come up with any position of that. Because we are now under an emergency situation because of the pandemic. Those that are arrested. Yes, in fact, when I was there in Makeni before coming back, we already don't make moves in Freetown. That make them do quick investigation. Those who are found wanting, then may then continue the investigation.
So would that facilitate this process?
Definitely the office of the Vice President, no saying in the chairman of the Police Council. So definitely with the IG, they are already speeding.
Wara Seri Kamal. Now one pan the lawyer them, where they represent the accused them, where they now the CID for sake of the Makeni riots. A give status of in clients them, how then they do now the criminal investigations department.
As far as an update on the status, I just want to make una know say today the 51 people that were detained from Makeni last Saturday, they still the CID, they're not charged there yet, they're not released any of them. This include 12 juveniles, very young people between the ages of 14 and 17. But they work with the police for try to get them released. So far, I'm not happy yet. We hope say that they go release them in the next day. Otherwise, I think at this point we go force for take further legal action for try for get them released. Already, as I said, they don't hold them since last Saturday, today now the day 10. So that they far exceed within the Constitution they allow the police for whole person because it gets say within 72 hours in most offenses, and the offenses then as far as we can see, no rise to the level of a capital offense or a carry life imprisonment. We ain't go allow them for holding for 10 days. Otherwise, they don't release them within 72 hours.
As Ambassador Fudeyum Kela say, government they work now for implement the recommendation them wey dem gather from the meeting at McKinney. People hope say this go be, especially for free the one them where police fair not say no concern pan the riot, but they now the criminal investigation department for over 10 days. For the Society for Radio Democracy, Musa Kamara.
The program is still listening to now. Good morning, Salon. And don't forget to use it for the listen. The program can add voice to Tine with the talk bot. And our cell number 0779819881. Now they go send a message or go to Radio Democracy 98.1 Facebook page. Today now the program with the talk about hepatitis as today now World Hepatitis Day. And the theme for this year now find the missing millions. Well, we get Dr. Suleiman Lakon at the program this morning, winner coordinator for the National Hepatitis Task Force at the Ministry of Health and Sanitation. They don't tell we waiting hepatitis, how people they get and serve the most common one within a salon. We can continue for look at this particular issue, but shortly, they will go back in our studio to and take a short commercial break.
Because in confusion. But this confuse me, boo. Look where Uncle Nat in World Solid. Look him block them with them beat for them, where they save solid, and at the same amount of cement and sand that they use for beat me on. But look what in the happen. Me wall down for them, all the block they all don't scatter. It's like say some kind of magic they behind this. You want to know the magic behind this? Now the superior quality, extra strong, extra life and extra yield cement where are they use, and that's not Dangote 3X Portland limestone cement. Dangote cement now the highest grade cement in the country. When a 42.5 R grade cement, when no one day come na this country, and a one of the highest grade pan cement where you go get na the wall. Where you want you concrete, wall and block solid, use Dangote 42.5 R cement, you no go regret them. You go get Dangote 42.5 R cement na online shop and building material store na the one whole country.
Alright, so we continue with the program. Good morning, Salon, where they come to you from the Society for Radio Democracy 98.1 FM. Dr. Suleiman Lako still there with me at the studio as we talk about hepatitis, and today now World Hepatitis Day. So I can't see them all over the world. They come together with one theme when I find the missing million for raise awareness about this particular sick. Doc don't they tell we about how the sick they transfer from one person to another. They don't give you statistics of the people that we get the sickness salon. Now let we look at the recovery rate. How you can assess the recovery rate in as much as the statistics that we give you look high, small, and somebody they listen to you go feel like say a scary number them.
Yeah, Khadija, I mean, just want for maybe complete the aspect of the interventions we government undertake.
All right, go ahead.
Where I think it's very crucial for a lot of people to understand. Then from there, they come to the recovery rate or the treatment as an entity. Mm-hmm. As I mentioned earlier on, we actually don't take some steps as a government. Last year we developed the first guideline where they provide a direction on how to treat hepatitis B and C in this country. And earlier this year, we've been trained about 50 doctors on that particular guideline. This guideline will disseminate to healthcare workers as much as possible during this particular period of time. No sooner we'll get the Ministry of Health, don't sign it off. But beyond that, we plan for law conduct a national survey for understand the true picture of the hepatitis. You know, where they don't conduct a survey, know what they happen. That information they able use and for plan how to go forward in terms of handling hepatitis. And this, we don't partner with the Chinese Center for Disease Control and Prevention, when they also support we on the development of, on the validation of the guideline and training of those then doctor then they. If not to be this COVID situation, by now, before they give a preliminary data on what did happen in terms of hepatitis among the general population. Now, after that, we plan for law undertake what they call the development of a strategic plan, a plan with a lead way, how for handle this hepatitis. For example, involvement of the media, involvement of civil society, various traditional groups, which direction we will take in terms of this hepatitis. So there and there, these are the plan activities that we want to do for reduce the burden of hepatitis. Now, frankly, the recovery rate for hepatitis depends on the type. Hepatitis A, hepatitis E, they one then they resolve for themselves. They don't need any specific treatment. They know they take long in the body. But hepatitis B and hepatitis C get tendency for remain long inside the body. And then called chronic. Chronic in the sense it don't be inside the system for 6 months or more, and say chronic hepatitis. Now, what did happen is, if an adult acquire hepatitis, that adult they get tendency for take care of them in 95% of cases. So like what they so, if I acquire the tumor, what they call hepatitis B, the body immune system, it affect them, it pull and come out inside in about 90 to 95% of cases. So if not to be done, 2.5 million of the world population, and then for don't get hepatitis chronically, but majority, the body they take care of them.
So treatment, specific treatments, no D.
That's one aspect of it. The other aspect of it is the one that would be left with that chronic state, that 5 to 10%. There is a tendency for the body take care of them in about 0.5. That's 1 in every 200 patients that we get annually. Then they happen. Now, in terms of specific treatment, there is specific treatment for hepatitis B, and there is specific treatment for hepatitis C. Hepatitis C is easy for handle as far as treatment is concerned, just like the cost of medication, the side effect. But other than that, most people give them medication for 12 weeks, and they are fine. They are okay for hepatitis C. Hepatitis B self-gets specific treatment. Some medication, in fact, one day we worldwide, widely approved, we also they use them for HIV, we then call tenofovir. And one of the drugs that we give people, we need treatment. Not to all man need treatment, because when the virus they done, the medicine not able to act on them. But if the virus activates, then the medicine will be more effective for handling. This now the challenge they get with treatment of hepatitis at this moment, because the medicine not able to follow the virus when it's low, but when the virus they high, it is suppressor. And when it's suppressor, you protect the liver, because that's the most important thing, is to protect the liver, protect other structures, so they not they get issues. That are the essence. So not to everybody we get hepatitis B, they receive medicine. When we see patients who get hepatitis B, we assess whether the liver normal or not, or you don't get structural problem. Structural problem in the sense you don't get scar. If the liver don't get scar, we give medicine. Or if the liver not get scar, but if they produce the chemical that they should say it don't damage, based on the level, certain threshold, we go say, okay, this person, you need for take medicine. And at times, we couple land it up also with the assessment of the level of the virus inside the system. So if the virus in level high, then they also go depict as to whether for give medicine.
Earlier, I asked you about the recovery rate. With them medication there, so we don't talk about. Say normally when I can get to people, when I can diagnose, say they live with the hepatitis B or C. How you go compare the recovery rate of Salone to other countries them in the world? We get patients them where they live with hepatitis. Some don't even turn to the chronic one.
So, frankly, in terms of the treatment recovery, not widely variable. Frankly, we'll not get study or go look at prospectively for look at people. But from the global literature, not widely variable. As I say, hepatitis C, most people when they recover, we give them treatment for 12 weeks. They are fine. Hepatitis B might require a long duration of treatment, and sometimes even for life. If the person already gets scar of the liver, you need treatment for life, whether it recover or not, whether the virus don't suppress or not. But for hepatitis B, usually we know they define the period, how long will they give medicine. We just they give medicine. Then we observe. Doing the monitoring, we will know whether changes don't happen when they make this person or actually clear the virus inside the system. If the person don't clear the virus, we just they extend the treatment for 12 to 18 months. And thereafter, if you're okay, that is fine. But mostly, what I will reassure the people is hepatitis B, it not get a definitive treatment. That I must say. In the sense, I will give this medicine for 5 months. You know, that medicine, they know they at this particular moment. But if you give medicine over time, the person, some people, and they suppress the virus. Or some people, as long as you suppress the virus, the liver, they in a safe way. That makes all man okay.
So how you
not get cancer, you get scarring. Yes, Mama.
How you go explain the seriousness of hepatitis compared to other accidents? Because if you tell people about HIV, the rates, the kind of attention we then go give them, we not see people they pay that kind of attention to hepatitis. So how you go explain the seriousness of this sick?
Well, the seriousness of the sick now that number one, it kill a large number of population in the world. If we talk about a population of nearly 1.5 million, that's now a very serious condition. And also, when you combine hepatitis B and hepatitis C, you get nearly HIV, there are about 39 million people where they live with HIV in the world. And when you combine hepatitis B and hepatitis C, you get 328 million people. So you find out say that also say this condition is serious. And on annual basis, 1.5 million of them, and they nearly that value, they die. So that makes it serious. Now, when it comes to the sickness, how they manifest inside the body. Now, hepatitis B and hepatitis C, they result in liver cancer. And when somebody gets liver cancer, it's very challenging for take care of. Now, sometimes if you not progress at a stage, then you can do liver transplant, which is very expensive, which is very costly, and we're not available locally. On the other hand, yes, of course, HIV also gets your manifestation associated with some cancers, which some of them can be handled locally. But the aspect here is not to compare the two. They are all very serious conditions. But hepatitis, because liver cancer, we highly fatal. That means it kill. It kill some people and faster. In fact, if it takes some people and follow their up and get liver cancer, within 6 months, majority go down die. That's not the challenge with hepatitis C they get.
At this point, and the seriousness of the sick, we don't explain this morning, and every year, owner as well, body workman, and they encourage people for going to hospital, go do tests so they go know their hepatitis status. Let me look at the facility the way they now. For let somebody go and do in test status for know if whether or not it they live with the sick, and how fully equipped the center they are to be done.
So we don't develop the guideline, and Khadija, I'll tell you, I can do hepatitis test based on the guideline we develop. Now, yeah.
Okay.
So that's a point of care test. For let you know your status, somebody can move. Point of care. Okay, they are can do test. Maybe a can do maybe a test. So not that it's a complex infrastructure we need for able for no see this person get hepatitis B or hepatitis C. No. We need simple infrastructure for able for do that.
So the putting and waiting.
So if you go to any facility, then for able for do that, any government facility and even private facilities, then for able for do that for you, hepatitis B and hepatitis C test.
So Doc, like I was sitting at this studio so now, you see the able for do me test.
Yes.
For know whether if I live with the hepatitis B or C. Waiting you go need for do such kind test. Where somebody they listen to you now and the seriousness of the secret they're explaining, if you say you need extraordinary equipment them for do such a test.
At that initial phase, we will just try for know whether the person gets or not. We actually don't need extraordinary equipment. We got to call rapid diagnostic test. And now they take no more until like a small capsule. We take them, we go do the test for the person. So until you get small, we then call lancet. Once until they prick you, forget the blood, they get you cut you wool, you swab the place, and it done.
I think just want offer for you get a sample done live because you say you go able to do one live.
No, yes. Oh no, yes. For confirm whether this person gets hepatitis for skin,
so
yes.
We able do now.
The challenge will get we don't know now say this person gets. That's where the challenge comes, and the challenge is that after that period, they need to assess the person. And it's expensive for take care of somebody who get hepatitis. You need for do scan, you need for do liver test for assess the function, you need for do other test them, sometimes and even the blood picture for help you for know whether this person gets scar inside in body. You need for do other things. Some other tests that we not available at this moment.
So just by seeing the blood, you're able to know if this person gets any scar in blood or the virus?
Oh yes, you can do some blood tests where they tell you whether the liver gets scar or not. So then they call AST to platelet ratio index.
So I see we producer don't can give them. You want for just do some kind of experiment for let do the test this morning?
Unfortunately, if I've not been planned for that, but of course, if not to be in this COVID, if I don't do some outreach programs, for like kind of radio democracy, kind of access, but potentially those are things we can partner with over time. And potentially, we can also do something for communities, deprived communities, etc. But of relevance is that all man, for find the missing million, let all go for a test. No sit down say I not get. No sit down say nothing no they do me. Like when I've been they ask for the symptoms. How possible say get hepatitis? Most people are not getting nothing. They feel nothing. Then one day they feel symptoms. Sometimes in eye they yalla, some mind they feel for vomit, some mind body they warm. They get pain outside the liver they, or then can say right upper part of the tummy. All anything they can happen. And at times if it don't severe, some man belly they team up. Some man, because water is full up inside his belly, if it's then they swell, in body they down.
So it don't reach that stage then, and now I can describe as the chronic stage.
Yeah, so the chronic not depend on whether the person gets symptoms or not. The chronic depend on duration. Yeah. So anybody who don't get that for 6 months or more, like say this person gets chronic hepatitis. Now, if you don't do that stage, you say you don't get complications. If you don't get a state in which your belly is swell, your foot and is swell, then are complication. Or you don't get a state in which you get liver cancer, then are complications there. Then are the state who go say this person don't get complications.
You talk about vaccine where like governments be don't they give free to picking them.
Yes.
And self the one they wanna be done support for the medical students and this vaccine I want to believe say plenty people where they listen go happy for take because they prevent the person not forget the hepatitis. But according to what you explain, now one way quite expensive if you want to go get them individually, if you want just one say, let you go get them. But if person not able to get this vaccine, in terms of healthy living, now waiting people for the practice for let you not go get this sick.
Now, if I can reflect on the transmission, we say one way now through sexual contact for hepatitis B. Now mommy and daddy business. I make the people away now MSM where they do my business to them with get tendency for get a high prevalence of them. Hepatitis C not they transmit through sex generally in the population, but they transmit among them and then they will then call men who have sex with men, they homo them, where they falla themselves now their waist. Hepatitis C get tendency for spread, especially the one that will get HIV. So you get tendency for spread. So meaning, one thing we need for do is for abstain, if you're able. If you're not able, now for make sure say you be faithful to your partner. Right. If at all you're not able, use condom. Use condom consistently and correctly. And those are some interventions. They work with other programs for take care of their hand and day. But beyond that, hepatitis C, hepatitis B, they also be transmitted through sharing of sharps. Get your machine, your own equipment for make your machine for barb. Let's see, and then they do as interventions for let it remain healthy.
What about the saliva kissing?
You know they get time by kiss, mama. They kiss okay. Sometimes you exchange one drum before ever you're able for give somebody hepatitis. And I don't think say that kiss they will be able for make you exchange one drum of saliva. But beyond that, mama, we in a belly woman, you get tendency for give picking. And belly woman is for test and take appropriate measures, appropriate interventions. The doctor will advise you on that day. So then, if your doctor not even go antenatal care, he not even tell you, ask and say, I want check for HIV, I want check for hepatitis B and hepatitis C. So I go know how to protect my own pikin. The interventions they are needed for make you able for protect yourself from hepatitis. The one they do female genital mutilation, tattoos. They put the population at risk, especially if they share equipment. You get tendency, we cut this, it cuts that same person. Then they get tendency for affect the people there for spread the sick. These are interventions who for make sure say we try for avoid as much as possible for law be safe. Law make sure say people and safe. Will not give them this particular tumbu we then call hepatitis. These are some of the interventions they will do. As government, we don't try at health facility level. If you go there, then they try for sterilized equipment, and they try to not use needle. At the same time, some man they practice now this needle they boil them. Hepatitis B, not they die by boiling needle. We don't use needle, dispose of them. One needle to one person. If we get for use another one, Yeah, if get for give another injection, use another needle.
All right,
There are
Doc.
interventions they will need for protect to people.
People don't send messages then for you na the program. Let me just look at few of them so you go respond. This one they say, doctor, is it possible for one type to develop into another? Example, type B developing into type C, or type C to develop into type A.
This other message you look at say, how often can someone do the hepatitis test if I cannot afford the vaccine?
This one they say, good morning, doc. What a dangerous disease. So baby born from an infected mother will also contact this disease. This is very scary.
This one say, doc, is hepatitis test free from, and from which hospital can we go for the test?
This one they say, doc, what are we benefiting as a country in celebrating this day? Also, the percentage rate of people living with this sick is very high.
This other one say, why is the increase on the disease? Is it because of lack of knowledge or the disease, or are there no tests?
More messages then come inside the program this morning. This one they say, from Lamin Kaloko Nakabala, they said, therefore call on the government to try and release the people they have been arrested during the Hudley situation that took place in Makeni.
This other one said, doc, is it possible for one to be healed from the virus and get infected again?
This one they say, good morning, doc. Why the government will not give free vaccine to all health workers before employing them to various hospitals? They come out from Amadou Issa Kamara.
All right, this one I go look at from Alex Smith on Facebook. He say, in other words, that means if you have hepatitis B in Sierra Leone, it's a death sentence.
All right. From their messages then there, I think say we can out to Dr. Lako for let go respond to some of them. Doc?
Yes, thank you very much, texters and listeners out there. In the first place, hepatitis B, not hepatitis B. And it remain for be hepatitis B for life, if at all it is inside the person's system. There is no way hepatitis B they change to hepatitis C. Just about like if me get me small brother, it remain as me small brother. So I name day, na so you name day, na so myself day. So one not they transform into another. Hepatitis A, B, and C na just nomenclature. Now, frankly, this data is gloomy. That's how I go put them. But we therefore do make efforts. In as much as the government they make effort, we also as people like therefore make efforts. The first place, let you know about yourself. We know about yourself. You know, encourage your neighbor, your family member for nobody themselves, their status on hepatitis. When we do so, we take measures in place for prevent yourself. We are able for change this particular scary data into something we go make we all happy. We'll all be safe. We're free from liver cancer. We're free from liver scarring and some other problems that were related to hepatitis B and hepatitis C and any other form of hepatitis. Now, the hepatitis test is not free. For now, at this particular moment, we not provide free hepatitis test except on certain occasion where like sometimes we're able to source some resources and provide some tests there, en masse.
Enough
for certain population.
Affordable though.
So the cost is affordable.
Okay.
Then test they tell you so some side they go 50,000, some side they 20,000. You not even reach down there for your own protection. I think say that not for be a problem. And you can go any government hospital. If they not get it, then they refer you. We get a referral system. Say, okay, we'll not get vaccine now, but you can go so side. If you not get this kind of test now, but you can go so side. Give able for them. That chain of network is there. So the test is
Lord try for know the people who they live with this particular disease.
Yeah, we do that last year, but we'll not go do that this year. We all know the situation. You know, getting people in together, the infection prevention interventions is a big challenge. You know, we get for preventing people you go so it's very challenging when you get a crowd. But last year, we screened over 950 something people and provide them some linkage to care services, follow them up. I think so far we don't do the same thing, if not to this COVID response. But I hope so people can go understand with me at this particular moment. Now, what will they benefit as a country as we celebrate, commemorate this World Hepatitis Day. We benefit a lot. The first thing are there, some of my colleagues are there, other media stations at this moment, they talk to about the sick. For law prevent yourself. Lord, take all the measures that they talk about. That's one thing that they. But also, this is now a way for established partnership. I believe say we don't establish partnership, or we strengthen the establishment of partnership with media houses like Radio Democracy. This is not the essence. For also make we self the professional, Lord reflect. Say, oh, this particular sick day, and we therefore do as much as possible for reduce the burden of this sick among we young people than the necessity of this particular day. More importantly, for also make the general population really listen to me. Let una take measures in place for preventing yourself from not get hepatitis. If you know say you forget more than one woman, use condom consistently and correctly at all times. Avoid sharps as much as possible. Not take other things that will get the effect for damage the liver, like contimedicine, excess alcohol. If you get hepatitis, it just don't create a relationship where they make the person the worse more. It gets the liver, they continue for damage more. Make sure say you prevent all them things then they. Make sure say you get your own barbium clipper. Make sure say you get your own equipment for go make you here. Those are the things. If you get belly, ask for your hepatitis test. And if you don't get, ask for Maclate so you remain protected.
So how long will the Maclate work on the body? Where you take them? How long will they for?
The Maclates we dey give them at 0, 1, and 6 months. Now what did this mean? So I can't to United, I can't take Maclate. You don't give me. Then at 0 month. 1 month later, you can take the vaccine back. Then today the 28th, so the 28th of next month, I go for my second dose. And thereafter, 5 months from that particular day, I take the last dose. So 6 month duration, you don't get complete immunization and significant booster. You don't get complete immunization and significant booster 6 months later. So you take the Maclate at 0, at 1, and then 6 months.
No, so like people that we don't big, we're like not so picking again 0 to 10 years. People that we don't be like adults them.
Yeah, now adults are they talk so.
Okay.
This schedule where they talk to you so now adult. What I mean like somebody who don't pass 5 years and above. Let's say adult children above 5 years. And then they talk so. Like they take the Maclate at 0, at 1 month, and then 6 months. Now then they use schedule. For the picking them, when they below 5 years, or when are infants, they use schedule ideally na back dose. As them born now, within 24 hours, get hepatitis Maclate, and then go complete the Maclate later at 6 weeks, 10 weeks, and 14 weeks. These are things we'll be inquisitive about, for law prevent hepatitis. We'll make sure say we ask questions to healthcare workers.
Doctor.
We'll make sure say these things are provided to us.
Because
for them, some of them are free.
Oh, play the report. So say we reporter go work na Globe Pharmacy. We like then don't do the test for people them. The number that we come they show say na man them more they get it sick, pass compared to woman them. So like they man in the way like una the not say they get it sick, but una which age bracket they fall within?
Now, frankly, as I say, these are all studies that we not look at a nationally representative data. You know, we plan for do this survey. For all understand, for example, if we say HIV between 18 to 24 years, now then get high prevalence of HIV, with certainty go talk so. But this is so random that maybe a 60-year-old man, they come, he can't take the test. Other person go come, he can't take the test. So it's difficult for like generalize which age group. But generally, the pattern, if we can borrow the pattern from HIV, young people, you know, they engage into more activities, and they are more likely forget some of their infections there. For example, hepatitis, because they're sexually inquisitive, they might. So then they all put them at risk. And some of them, they also into some other activities like MSM, even drug use. They want the way they inject drugs. And then they all, mostly now young people, and they into them thing there. They're not getting money for sustained prevention interventions.
Doc, looking at the statistics and the rate at which the disease they spread, and on ourselves when at the health worker them when at the front lines they get infected. What in this task force they do for lobby to the ministry for ensure say una as front lines worker them get the protection we una need?
So Khadija, as I tell you earlier on, we will develop a strategic plan. First thing, if you don't know the direction where they go, you write them, they know side they go, it will be difficult. But even before that, you also need to understand the true picture of what they happen. You know, we don't put data together on all the study they wouldn't do for hepatitis. Now they realize, say, some people and they at risk. For example, healthcare workers are at risk for hepatitis because the work they do. But when you look at that pattern, we say 8.7. Go back to the one that we know to healthcare workers. The man who donate blood no more. Now 15.2%. So if final say the data is not too much for synchronizing self. So what you need for do for able for put interventions together where they benefit the people that we need them at most. Now for make sure say you study the population and do something. But beyond that, now we'll continue engagement. We got plans for even the engaged healthcare workers for the teach them online about hepatitis. So then a way for increase the knowledge of healthcare workers. So then go know how them for treat hepatitis. You know, we get a situation at this country where as possible test for hepatitis, so then say go take medicine. Attending now them begin prescribe some boku medicine there. Where most times you don't even need them. But this not because maybe the knowledge is not there. We therefore go into that day, we'll continue for talk to people, we'll continue for teach people. They will not go just stop that. They provide what you call supportive supervision and mentorship for follow-up and understand whether what they say, people really they comply with them. Now, beyond that, we they continue for advise government. You go for put resources into hepatitis. If they say a large population is affected, we go for put resources into hepatitis. That's now the biggest challenge we'll get. If there are no resources for hepatitis, then it will be a challenge. We're not going to do
talking about this advice, as it is now, year in, year out, on the cam, na the media, talk about hepatitis, talk about give people in statistics and all, talking about the advice on intent for Gito government, we think will be the key priority area.
So the key priority area at this particular moment, now for Lord do a study, we will tell you what they have with hepatitis. Okay. And rest assured, say that they don't settle. If God make this thing go down, this COVID business, things become normal, then we will undertake that day. Our second priority now for develop a roadmap